welcome to another video here on the Badger Story. Today we are going back to Santa Monica to find out what my treatment will be. So if you guys don't know, I had a reoccurrence of my cancer and they stopped my immunotherapy, which was Keytruda, because it wasn't working, and I haven't had it in a couple months, and so my body's starting to feel it. At least my body's starting to feel something. And well, today we're gonna find out what my next treatment will be. They said more than likely it would be like a pill and the possibility of radiation treatment. So radiation treatment with me, probably not the best idea, just because of how much my body's been through. And we'll go over that later in another video. But looking for some good news when we get there. So what I'm gonna do, I'm gonna try to see if I can get record what they say, record my reaction and things like that, and then talk about it more afterwards. So we'll see you guys in a little bit at the hospital.
So do I get to look at this even though it's the surgeon's? It looks great to me.
Yeah,
much better. I'm not start picking at it anymore, huh?
yeah.
You feel okay?
Yeah.
Okay, pretty soon you can
It just dried up a little bit, but that's probably because of the heat.
Yeah, where you are, right. Yeah, okay. Where was the graft from? Where did the graft come from? That's what I thought, yeah. Yeah, that's
You're going to get the head and the stomach.
I guess they were hoping you'd have a hairier chest and you could, like, trying to take it.
Thankfully, you can flip his hair.
Yeah, I know. It's true.
Yeah, you should have gone a little bit higher up. I mean,
yeah, really,
it
exactly.
This looks really good. It's not bothering you, right?
No, I know there was like a little.
Yeah, I'll make sure there's no stitches.
Oh, right here. Yeah, right there.
Good. Okay.
Let's see how your neck is doing.
The swelling went down. I've been getting a lot of swelling right here. You see how the lumps right here?
Take your stitches out.
And then here it's been like swelling, and then behind the ear, only you can still see it's like this right here. It's been going like all the way back to the. Bless you.
Excuse me. So you're saying like most of the swelling is down, but what you see now is sort of more lumpy swelling?
Well, no, this is like it's just. I was saying it's just swelling. It hasn't gone down from last night just because I slept.
Yeah.
I think, and then just the head. But most like the sharper pains come behind the ear, but then it's like really, really like makes my head feel heavy. In the morning when I wake up, I'm always lightheaded. Like I have to take a minute.
It's like pushing on a carotid or something.
Yeah, I'm gonna feel for it once I wear gloves.
And I've been tired like a lot this past like 2 weeks.
How are you eating?
I'm eating fine. Yeah.
You didn't get any labs today, right?
But
You had been a little anemic, but you weren't as anemic last time I did. And Dr. Weaver, I think, was doing some. He checked your iron; it was low, if I recall correctly.
I thought it went back up.
Well, the hemoglobin went back. Yeah, your red blood cells went back up a little bit.
Okay.
Yeah.
Did you ever have a chance to call the radiation oncology department?
Me, no.
Okay.
I didn't know.
Talk about it yet. Okay.
Yeah.
We weren't sure.
So I think that I'm not sure if anyone talked to you after the tumor board that we had, where we discussed your case. That was like a week or so.
2 weeks ago.
2 weeks ago. Yeah. So we were. There was a bit of controversy. I mean, that's the whole reason why we present people at tumor board. It's never with the easy, straightforward cases. They don't make it to tumor board. You have to be special. So you know, there's always a bit of controversy when it comes to the decision about doing radiation therapy after surgery on an area where the lymph nodes were involved and where they were maybe either a lot of lymph nodes or they were stuck together or there was a tumor pushing sort of out of the nodes, making us worried that it might grow back in the region. But I think the sort of majority, even though it wasn't a formal vote, was to do radiation, and I would certainly feel more comfortable with radiation. And then the drugs we were talking about, we prefer not to give them during radiation because they can make your skin a little more sensitive to the little bit of burning that the radiation can cause. And there's no like rush to give those drugs because those drugs are supposed to prevent melanoma from coming back, and rather than treating something that, it was not like we were trying to get the tumor in your neck to go down, because that's already been removed. So my proposal to you would be to have the radiation doc see you, and then do radiation, which would see, how are we going to do that? You live so far away. I mean, the possibility would be to have you do radiation closer to home as well. And the radiation docs here, I think, probably know a lot of radiation folks and facilities in the general area. They would also know, I would think, which facilities are capable of doing, if you need any specialized radiation planning or a special machine, because sometimes it's very straightforward and sometimes it's a little fancier. So I think seeing them, I wish that I thought to have that happen today while you're here, but I didn't think of it, and I guess these guys were thinking more of a post-op, check. So we'll make that happen. It's not a rush, but I'd like to get the show in today. Yeah, I was gonna say they're super nice, and so I hate to use the ticket.
I think everybody here is.
But yeah, the radiation docs are particularly nice. They've just always been available, and so unless they're physically unable to see you, I suspect they'll say, "Oh yeah, sure, have them come in at 1 or something." So we'll let Melanie do that, and then. We can coordinate with them. As I say, they'll either say, "Oh, it's got to be here," and then you guys will have to figure out a way to do that, or they'll say, "Oh yeah, we know a place up, up by you."
How often is radiation?
Well, usually it's daily for several weeks. In something like this, I would guess it's going to be daily for 4 or 5 weeks. Some kinds of radiation are just zapped, 5 times, or they're zapped, once. But this particular type, I think, is going to be a daily on the weekdays for several weeks. In the neck, there's a lot of other structures that they want to be careful not to burn, and so one of the best ways not to burn the other structures is to give the radiation slowly and let everything, heal as it goes.
Side effects?
Well, the most side effects when you're radiating the neck are the tissues underneath would be like your throat. And so sore throat is the main thing, depending on whether it crosses, like if it were to cross where your tongue is or your cheeks, they'll tell you might get some sores in your cheeks or on your tongue. It might be a little harder for you to eat, which obviously in your case is an extra challenge because you're diabetes, but I'm sure that will be, that's why radiation centers always have dietitians, because a lot of the patients that they radiate have oral issues, and they have to take the nutritional needs into account. Furthermore, the better nourished people are, the better they'll do with the radiation. So they always have reasons to have a dietitian involved. Okay. So all right. So I'm gonna leave you in Melody's capable hands.
Did we ever discuss your path together last time?
The what?
The pathology from your last surgery?
No, I did read it online, but
you did.
But you can always.
Okay.
To make sure we get it clear.
Together?
Yeah.
Okay.
Because we didn't come yesterday.
Yeah.
I mean, yesterday, last week.
I'll explain everything to you. And have you started her medications yet? No, you haven't
started anything.
Okay, good. That's
I've been off for like 2 months.
Exactly, because they want to do radiation first. Okay, good. So this is the final path, and it tells us that obviously we're taking skin from the right neck. It's a redo because we're doing another dissection, and we took out 10 lymph nodes from here. 7 out of the 10 did have melanoma in there, and it says how big they were. The right scalene, that's a muscle in your neck, basically saying that we did find melanoma there. Basically what happens is here we found lymph nodes, here we're actually finding bigger masses, and that's why they were palpable in exam before your surgery. So they're saying they're not lymph nodes anymore, they're just saying like tumor masses, and we took those out. Scalene is just a muscle. Sternocleidomastoid is another muscle that helps you move your neck, and again there was a lymph node within that muscle that was positive. We anticipated all of this, and they're out, so that's good. And then your right lower jugular is a big artery that runs down your neck, and they were saying 2 of 7 lymph nodes lymph nodes on this artery, 2 of them were positive for melanoma. Okay, all of these have been excised, they're not there anymore. Okay, this is for you, you guys can keep. I'm gonna take your stitches out now. Okay.
Okay.
Professional lines, which is kind of unusual, but that's my background. Okay, I'm unusual because I'm in the private sector also. Most of my colleagues are with institutions or the VAs or something like that. If you're to go fly down to Houston, Texas, at the big cancer facility down there, at MD Anderson, there's a whole bunch of people like me running around there. If you go to the Mayo Clinic, there's people like me running around up in Rochester, Minnesota. At the University of California, San Francisco, there's one person up there like me. Okay, at UC Davis, there's another person up there like me.
Wow.
So we're kind of few and far between. But we need a large population to draw from. Okay. Where we come in at, when we get set to take you into treatment, we just want to make dang sure that we don't get ourselves into trouble in the middle of treatment where we have to stop the treatment. We want to make sure that once we start, we want to keep going on high. Timing is always a problem. That's why Dr. Woolman just said, I said, send him over, send him over, send him over. This administrative day for me, but I said, just come on over, just send him over.
Thank you so
and
much.
So, but the deal is, I try never to hold up the oncologists when they're getting set to do things. And so that's why we try to push you guys right through. The best way to say is I make devices and stuff for the radiotherapist, but my principal responsibility is to make sure if we radiate up in this area that we don't get into dental problems right in the middle of the treatment. And so the rules are if we have to, if some teeth have to be extracted, that should be done in a very specific way. I don't take teeth out. I'm not an oral surgeon, okay? But I'm supposed to be the judge and jury if we have to have some teeth taken out prior to starting. I guess the other thing I want to say is I'm going to be your dentist over the next several months. We'll eventually work things out, but for right now, I'm in charge of your mouth, okay? How's that for a crazy comment?
I like it.
And so, but the deal is, we know some things can happen, it's nothing new. And so we know that we can play havoc with you, and we can play havoc where Dr. Woolman will get halfway into treatment and have to stop for a month. And that's not acceptable. It's going to decrease the success of the treatment by doing that. And so we don't want that. And so that's part of my job. And so let me just come in and take a gander around. If you play it by the numbers, head and neck cancer only makes up about 3 to 4% of all cancers. So you're in a pretty small category. And you're, I tongue-in-cheek say, well, you're a special patient. Okay. And that's, there's a lot of people, you kind of want to go to places where they treat a lot of this. The important thing is that we kind of get a precursory exam going and see where we're at on everything. Okay? Okay.
Either news.
Good news?
You're cool.
Oh!
So that's the important thing. Let me, by the way, real quickly, the average general dentist in the United States will only ever see about 2 to 3 patients like yourself over a 40-year practice span. So you're special. Okay. You're special.
Well, there you have it. That's what doctor's appointments were like. I have to admit, I did break down a couple times, small breakdowns. It wasn't major, and a lot of it had to do with my family, making sure that you know, bills were going to be paid through all this, and you know, it's going to be a lot of work for my wife too, not just me. So, you know, words are hard to come out after all this. You know, we already been through so much since the beginning of the year, and I'll make videos of when the cancer started, how the cancer started. You know, and basically it did start in January of 2022. So, and so far we've had 3 surgeries, and now we're going through. We went through immunotherapy, and then now we're going through radiation treatments with, I think, a pill that might be considered immunotherapy also. I'm not too sure, but it'd be a pill I'll be taking every day. But the radiation part really, you know, got me. That's the one thing I didn't want to hear going into this, and it happened to be the option for this case. Now, we found out too that my case is very rare. It doesn't happen very often where you have head cancer and neck cancer. So, you know, that puts it into perspective of at least how important things need to go before, you know, we do anything else, or we have to be more aggressive this time. We got to stop it where it's at, or it could get a lot worse. And side effects, a lot of side effects, anywhere from red in the neck, look like a sunburn, to swelling in my arms, to maybe having jaw surgery, losing my teeth, and the worst case will probably lose my voice box. And that would be fun when you're trying to do YouTube videos. But, you know, if it happens, it happens. My whole perspective of life is always be positive, and always know that you can get the result that you want by working hard and being positive. And that's exactly what I'm going to do. Other things, I don't know anything else that I can really say right at this moment. After all this, I want to let you guys know my wife and family, my parents, my brothers and sister, and I have a lot of help to go through all this. This is not a fun situation. Real quick, something else on the radiation treatment. It will be every day, Monday through Friday, for 4 weeks. So it's not going to be once a month. There's not going to be any breaks in between. And we have to drive 2 hours every day to get there, just because it costs $300 plus a night in the hotel room over there. Let's talk about bed and breakfast. We'll look into that. But I can do my plan is still to do my work. I'm still planning on working, but we'll see how it goes. Gotta do what's best for me and making sure, and my family, making sure that I get through this very well, so I can continue to work afterwards. But my goal is at least to try to be on disability less than 3 months. And so, me working at the beginning, I won't have any effects probably until starting the end of the second week. And that's when things are going to start kicking in. And just gotta have to see how it goes. It's going to be probably a day-by-day thing. Right now, we can get it in our city, but the reason why we're leaning and probably will go towards being in Santa Monica is because they're the best of the best near me. There's nobody who has probably more experience in California than they do. So, and this is a delicate situation. There's a lot of delicate stuff from your head to your throat that they have to be precise on, or it could be very damaging. So, you know, my faith is definitely with them. St. John's Hospital. They have done Dr. Essner, who is my surgeon. I must say, I barely felt really any pain. I do have swellings and some issues, but no pain really for me. It seems like, you know, he did a great job, especially when it's my head, stomach, neck. There's all sorts of places where, you know, I should be feeling pain and I didn't. There's some stuff that was irritating, but other than that, it was really good. And even my oncologist, I think it's oncologist, I'm not sure what the name is, but she is you saw her in the video, or she's in the video, she's talking in the video, you know, she's been studying me very well. They also had a board meeting for my case to do radiation, to confirm that radiation is the right way to go, and there goes my air conditioning, and they agreed. So yeah, again, I have my family, everybody's going to be helping me. My wife, she's going to be going through a lot, so please put in the comments, you know, support for her, and in my situation, you know, call, you know, prayers or thoughts or whatever towards my wife. She's going to be having to do a lot to take care of me, and it's going to cause her a lot of stress. It already has a little bit, but she is strong. The reason why I married her, you know, she knew that I have some cases. She didn't know I had cancer. I didn't know I had cancer when we got married, but I was already a delicate case when we got married, and she knew that, and she's a strong person because of that. And I know she, so far, like, through this whole time of cancer stuff, she's been on it, like on top of everything. So I give a lot of shout outs to my wife. She's been awesome. Love you, sweetie. You're doing a great job. Can't ask for anything better, honestly. Could not ask for anything better. Lucky to have her. So, anyways, it's gonna make this journey, this Badger story, a little more interesting now that I have to do radiation treatments, or at least for the next 6 months. It's gonna be interesting with the side effects and everything else. See how much more interesting it can get. But in the meantime, I'm gonna call it a night. We're tired. We're back and forth. Went through a lot of emotional stuff, so we're gonna call it an early night. But anyways, guys, thank you guys so much for watching. Please like, subscribe, and please comment too down below, especially for support for my wife, and you know, thanking her for everything she's done for me. And I couldn't ask for more than that. And I really appreciate it. Thank you guys, and I'll see you guys on the next video. See you.